If you have keratoconus, stop scrolling. There is a new treatment that sounds like an absolute miracle compared to what we used to do. It's called Epi-Oxa, and it's the first FDA-approved epithelium-on crosslinking. It promises to save your vision without scraping the surface of your eye. That means zero pain and almost instant recovery. It sounds like magic, but does this more comfortable surgery provide the same level of protection, or are we just trading effectiveness with comfort? I'm Dr. Ilan Cohen. I've been doing eye surgery for over 25 years and I've treated tens of thousands of patients. In this video, I'm going to explain what Epi-Oxa actually is, what Epi-On really means, who it's most likely to help, and the one warning that matters if your case is advanced. Let me start with why this is truly exciting. Epi-Oxa just got FDA approved. It means we now have a regulated, standardized Epi-On option, not an off-label workaround. Epi-On simply means we keep the thin skin layer in the front of the eye in place. That layer is called the epithelium, but you don't need to memorize that. Just think of it as the eye's protective film. When we don't remove that film, most people have less pain and a faster recovery than the older method. That's the big win. For a lot of patients, especially earlier cases, reducing downtime and pain can be a real quality of life improvement. But here's the critical pivot. Epi-Oxa being more comfortable does not automatically mean it's equally powerful in every situation. Now I'm going to explain keratoconus in plain English because the logic only makes sense if you understand the problem. Keratoconus means the clear front window of the eye starts to weaken and bulge forward over time. That window is the cornea, like the front glass of a camera. When that window becomes uneven, light can't focus properly, so your vision gets distorted. That's why your glasses prescription may keep changing and why night driving can become miserable. Crosslinking is a way to stabilize that window. It uses vitamin B2 drops and a controlled UV light to create more internal support within the tissue. The goal is not to improve vision, but to slow down or stop the worsening. Here comes the caution. That surface film we keep in place with Epi-On is not just the layer of skin. It's also a barrier. And barriers reduce penetration. So in a more aggressive eye where we really need a strong stabilizing effect, taking that layer off can allow deeper, more reliable delivery of the treatment. This is why the traditional epi-off method is uncomfortable for a reason. It is because removing the barrier can increase how much treatment reaches the tissue and how consistently it reaches it. You understand the concept. Now, what do you do with it? Here's a simple decision tree I use. First, we confirm whether the condition is actually progressing. If it is, we talk about treatment. Next, we judge how aggressive it looks. Is it changing quickly or slowly? Is the window getting steeper, thinner, or more irregular? Are you already struggling even with specialty contact lenses? These details matter because they predict how much strength we may need from the procedure. If it looks mild to moderate and caught early, Epi-On can be a very reasonable choice. Less discomfort can mean that you don't chicken out and actually get treated. And that alone can protect your future. But if it looks aggressive, fast changing, or advanced, this is where you should slow down and think. In those cases, many excellent surgeons may still recommend Epi-Off because the priority is the strongest and most proven long-term stabilization, even if recovery is harder. Most problems become manageable when you stop guessing and start following a structured plan. And if you've been overwhelmed by choices, that's normal. This is a high-stakes decision and you deserve a straight answer. As I said before, this procedure does not improve vision. It just stops progression. But if you want a procedure that can improve vision for patients with keratoconus, watch the next video here.